Welcome to the section on maternal health
from the 2024 Malawi Demographic and Healthy Survey. This section details the care women receive before, during, and after childbirth, critical periods that determine the health and survival of both mother and child. We will examine antenatal care, delivery care, and postnatal care, highlighting both achievements and areas for continued focus. Section 1. Antenatal care. Antenatal care by provider. Let us start with antenatal care, or ANC. The first encouraging finding is that nearly all women who had a live birth in the past 2 years received some form of ANC. The vast majority, 96%, received this care from a skilled provider. This is a strong foundation for safe motherhood. Looking at the breakdown by provider type, 70% received ANC from a nurse or midwife, 26% from a doctor, clinical officer or medical assistant, 1% from a patient attendant, and less than 1% from other providers. Only 2% of women had no ANC at all. Timing and number of ANC visits. 29% of women attended their first ANC visit during the first trimester as recommended for optimal care, while 62% achieved the recommended 4 or more ANC visits. This means a significant portion did not. A small but important 2% of women had no ANC visits at all. This tells us that while most women access care, ensuring they do so early and consistently remains a key challenge. Components of antenatal care. What happens during these visits? Among women receiving ANC for the most recent live birth in the 2 years before the survey, the coverage of key components was 79% took iron tablets or syrup during pregnancy, crucial for preventing anemia. 37% took medicine for intestinal parasites. 87% had their blood pressure measured. 88% had blood samples taken, but a crucial gap exists. Only 47% had urine samples taken. Tetanus toxoid injections. 89% of last births were protected against neonatal tetanus, and 78% of women received 2 or more tetanus toxoid injections during their last pregnancy. Section 2. Delivery and postnatal care. Place of delivery. Now let us look at delivery care. The data shows a remarkable transformation. 97% of births in the past 2 years took place in a healthy facility. Only 2% occurred at home and 1% in other locations. The breakdown by residence shows remarkably equal access. In urban areas, 98% delivered in a healthy facility. In rural areas, 97% delivered in a healthy facility. This near universal facility delivery across both urban and rural areas is a significant achievement. Assistance during delivery. Equally impressive, 97% of births were delivered by a skilled provider. The breakdown shows 69% were assisted by a nurse or midwife, 28% by a doctor, clinical officer or medical assistant, and 3% by other providers. Delivery by skilled provider by education. As with many health indicators, education is a factor. The percentage of live births in the past 2 years assisted by a skilled provider by mother's education level is: no education 91%, primary education 96%, secondary education 98%, and more than secondary education 99%. While use is nearly universal across all education levels, it is highest among women with more than secondary education. Importantly, even women with no education have 91% coverage, demonstrating that skilled delivery has become accessible to all. Trends in maternal health care. Looking at trends over time, skilled delivery care has nearly doubled over 3 decades, from 53% in 1992 to 96% in 2024. For antenatal care from a skilled provider, The trend shows 91% in 1992 MDHS to 96% in 2024 MDHS. This graph visualizes a decades-long successive effort to bring childbirth into the safe environment of the healthy system. Postnatal care. After delivery, attention turns to postnatal care, which is essential for detecting and managing complications in both mother and newborn. Here we see a significant gap. 66% of mothers had a postnatal checkup within the recommended 2 days after delivery. Only 42% were seen within the critical first 4 hours. Most concerning, 24% of mothers had no postnatal checkup at all within 41 days of delivery. This represents a major missed opportunity in the continuum of care. Key findings. To summarize the key findings, high ANC access. 96% of women received antenatal care from a skilled provider, doctor, clinical officer, nurse or midwife at least once. Facility delivery triumph. 97% of births now occur in a healthy facility. Only 2% deliver at home. Skilled delivery nearly universal. 96% of women were assisted at birth by a skilled attendant, nearly double the 53% in 1992. This concludes Section 6 of the 2024 Malawi Demographic and Healthy Survey presentation on maternal health.